Years specifically, we were working on how to specifically integrate the traditional medical system, particularly Ayurveda and other traditional medical system, into the main mainstream systems of medicines and how it can be easily assimilated, particularly these trends into the public health care actually. So in that context, various initiatives has been done by the government of India. So one of the specific initiative that which is more applicable to the insurance sector that I would like to discuss here, and what are the standards that we have adopted, and what are the ongoing efforts that we are actually undertaking in that respect. So all these issues will be our primary focus. So, needless to say, as far as the traditional systems of medicines in our country, particularly in this part of our country is concerned, we have generally, whether it is central government or whether it is state government, there is a constant support which is actually that is seen in the over a period of last one decade. So, as far as the popularity is concerned, the global recognition is concerned, we know, needless to say, that that is why we are actually sitting here in order to how to assimilate these trends into the public health system. One of the fastest growing sectors in India, you can see that from 2.85 billion in 2014, it has been now 6 times as per the one of the data of Invest India is concerned. Another one is position of India in the, it's a one hub for medical wellness and wellness tourism. That is also, it has been enhanced. A lot of countries in the world has evinced their interest, particularly the treatment aspects of the traditional medical system as a curative and rehabilitative, and even now, even the broad contour of the Ayurveda has been, there is an attempt to include it in the national palliative care also. So the exports of the our medical systems has been uh, generally to the USA, Nepal, Russia, Philippines. So all these incidents actually shows that the momentum that we have created over a period of 1 year. So, as far as generally there is a thought that as far as medical systems are concerned, they cannot talk each other. So, with this intent, actually, Ministry of Ayush has created a small vertical of what you call Ayush vertical in the Directorate General of Health Services, the mainstream Ministry of Health and Family Welfare, where this vertical is working in various aspects of the technical integration, how it can be integrated into the mainstream healthcare. So one example is the preparation of the standard treatment guidelines. Another one is formulation of the Indian public health standards for the traditional medical system. Similarly, we have also you may be knowing that even in the Kerala state, the Clinical Establishment Act and rules are actually being implemented, and Ayush also has been included into that actually. So all these standards and regulations will define the contour of where we are actually now standing and how effectively the insurance sector can make an awareness about this standardization process. That is very important. Similarly, the patient acceptance and demand, I don't know whether you may be knowing that the recent National Sample Survey Organization has actually made an enormous survey in which it has been clearly established that our rural population and our urban population, at least 46 to 53% of the population has been already undertaken the Ayush services at some time of their period of the last 1 year. So that itself shows that the relevance of these systems, And for in the state of Kerala, we need not say the relevance of this system, only we have to say that how we can bring that kind of linkage to these kind of patients and beneficiaries into the hospital setup, into the institutional setup. That is why the insurance plays an important role in that. As far as the NABH is concerned, already Dr. Upadhyay mentioned that 270 hospitals has been accredited. Actually, this is the little bit older data actually, wherein actually more number of hospitals, and now there is an increased momentum is given, because hospital accreditation is also, even though it is a voluntary accreditation, actually many of the standards, the trendsetters for the standards can be started from this kind of accreditation process. So fortunately, as we know that more than 50 hospitals are already accredited in the state of Kerala, and I hope that this will also be continue that momentum. So as I mentioned earlier, that standard treatment guidelines is the one of the important aspect which the when we insurance sector look into when we speak into this insurance for Ayush systems of medicine. Here specifically, there are two set of standards that we have developed from the Ayush vertical actually in the Directorate General of Health Services. One is for the common practitioner who is actually practicing in the public health facilities or even in the private healthcare facilities in the country, with a detailed what is the standards for each case, how to identify it, what is the nomenclature and what is the diagnostic criteria and detailed interventions and the primary level, secondary level, tertiary care, what are the referral criteria, what are the red flag signs, what are the pathya, what are the do's and don'ts. So everything has been systematically addressed in the standard treatment guideline that what we now refer in the standard treatment guidelines, which is published by the Directorate General of Health Services with in an integrated manner. Integrated manner in the sense actually, in preparing the standard treatment guideline, there are inputs from the modern experts. For example, we have started with musculoskeletal disorders, where the commonly reported cases of osteoarthritis, rheumatoid arthritis, cervical spondylosis, fibromyalgia. So these cases, how in a typical Ayurveda OPD setup, typical Ayurveda inpatient setup, how it is being managed, and how, what are the limitations for such kind of management, if at all there is a limitation, and at what stage the patient is ideally has to be referred for any further tertiary care like that. So on that basis, actually, we have devised these standard treatment guidelines, and which is now available in the public domain of the Ministry of Ayush. So you can refer that standard treatment guidelines, and even the insurance sector also can refer that standard treatment guidelines, so that specifically when we set a target for each of the insurance companies to address the, to honor the claims or not, actually, these kind of standard treatment guidelines are a basic necessities. So in the formulation of this committee, there is a national steering committee which is headed by the Directorate General of Health Services, and there was a working group. Enormous consultation was conducted with the research councils, national institutes, and even the private acclaimed practitioners of the country was also inducted into that, and there is a peer review, and there is an editorial board. So based on that extensive consultation process, actually, it took almost 1 year to publish only for the musculoskeletal disorders. Now we are actually entered into metabolic disorders, actually. So as far as the SDGs is concerned, this is a major contour of the disease condition, the name of the disease, case definition, then diagnostic criteria, clinical examination, supportive investigations, which is amenable at that level of institution. For example, every healthcare institutions in the country may not have all the kinds of facilities. So, for example, the dispensary in the rural setting, they may have very limited resources. So, because we see the guidelines in the larger perspective of the whole country, rather than one tertiary care institution, on that perspective alone we cannot see. So from the rural dispensary where the resources are limited, to the tertiary care institution where the sufficient number of doctors are available, paramedics are available, therapists are available. There your choice is more. Even the wide range of medications are also available. And we stick on to the essential drug list published by the Ministry of Ayush. I hope many of you may be aware about that essential drug list which is published by the Ministry of Ayush, which largely covers most of the medicines which is used in the routine manner in our day-to-day practice throughout the country. And from that we have taken for many medicines at the primary level. Then secondary level the choice is little bit more, and when we come to the at least the more than 50-bedded hospital or 100-bedded hospital, there the choice is still more. Up to 200 medicines, up to 300 medicines are actually indicated in that list. Then even the red flag signs, which is actually in consultation with the modern medicine experts, we have actually made. Similarly, the preventive management, which is a very hallmark of the traditional medical system. Basically, we generally see that there are certain conditions which modern medicine is not able to make any response on that. For example, pre-diabetes. Generally, we often ignore pre-diabetes as a condition which is not to be treated. But actually, if we tackle the pre-diabetes at an early stage, many of our disease burden in the context of the non-communicable disease will be able to effectively control in the country. So that kind of awareness we have to create consciously in the community so that the people will able to come to the healthcare institutions which is offering Ayush. This is the 6th disease condition. Currently, we have already published osteoarthritis, rheumatoid arthritis, cervical spondylosis, lumbar spondylosis, fibromyalgia, and adhesive capsulitis. Then this is the which is available in the e-format. Actually, you can easily download from the Ministry of Ayush website. And we have also, for the purpose of the classification and recognition of the disease condition, you may be knowing that Ministry of Ayush under the WHO regime, actually ICD classification also we have done. ICD 11 classification, which is, there is a separate chapter 2 for traditional systems, Ayurveda, Siddha and Unani. So under that, the Ayurveda terminologies we have tried to correlate, linked with our STG, so that there is a uniform nomenclature for each disease condition. As you may be knowing that we varyingly using Ayurveda terminologies in different regions of the country for the same disease condition. So in order to avoid that kind of conflict, actually, we try to integrate into the ICD 11 classification in our STGs. Then interdisciplinary learning, it is also useful wherever, because many of the now modern hospitals have an Ayurveda unit which is actually in the corporate setting, etc. actually. So there, these kind of STGs will be the basic document in which the physicians between modern medicine and Ayurveda can mutually connect and further make the efforts for the integration. Then another initiative that we have taken by the DGHS is the Indian Public Health Standards, actually, which is published by the Ministry of Ayush. Basically, the intent of the IPHS is mainly to strengthen and also to standardize the public health which is delivered in the Ayush sector. So as you are aware that whether it is public sector hospitals and dispensaries in the country, which is run with a different set of guidelines, which is actually formulated in an ad hoc manner. So over a period of time, Government of India, for modern system of medicines, they have made the IPHS, which has been updated in the year 2022. However, Ayush was not a part of that IPHS at that time. Therefore, ministry thought that these public health standards to define what is the minimum number of, for example, what is the minimum number of therapists required to do a Panchakarma therapy. Because until and unless that quality standards are defined very well, then only the quality which is of the care which is provided to a beneficiary can be assured. Based on that, the standards has been provided. Even the standards for the prescription, even the standards for auditing the prescription, even for example, what is the space requirement, what are the equipments, what are the instruments which is used for the various kind of interventions in Ayurveda or Ayush systems of medicines. What are the minimum essential drugs which is required? What are the rights of the patients? Everything is defined in the IPHS standards, and based on that, for Ayush hospitals and now known Ayushman Arogya Mandir, Ayush, for that also Ministry of Ayush has defined. So, with these discussions, these are the gross STGs and IPHs published by the Ministry of Ayush. And for the very specific purpose of the insurance sector, actually, Ministry has actually constituted a committee, and Rajiv Vasudevan is also going to come in the next as a speaker. So he was at that time, there was a committee constituted by the Ministry of Ayush under the chairmanship of the DGHS, and they have formulated specific guidelines for the technical guidelines in the context of very specific format, based on a very specific format for more than 274 disease conditions, which later consolidated into 150 disease conditions. There the details you can see. For example, with the break of the package into elements, how to control the frauds, because there is a enormous guidelines are there available for the insurance sectors for how to control, because unethical way some hospital is actually doing the practice of enrolling the patients and claiming the amount from the insurance. For that purpose, whatever the specific control practices are been very clearly enumerated in these guidelines, and the measurable treatment outcomes, because generally there is a thinking that the Ayurveda treatment outcomes are not easily measurable, because generally we define in terms of quality of life improvement and other things. So we have to very categorically say it is not only the quality of life improvement, even many of the objective parameters which generally the outcome scales used in the modern medicine equally can be applicable to Ayurveda when we're dealing with many of the disease conditions. That we have to categorically document and share. Then nobody can challenge the claims of the Ayush systems of medicine. Similarly, where are the surgical and medical management, even though the surgical management may be limited in the context of Ayurveda, pure Ayurveda, but there are certain possibilities, whether it is rectal diseases or the anorectal clinics, or various anorectal clinics are practiced even in the gynecological disorders, or many of the practitioners are practicing these kinds of interventions. That also, it is a strength of the Ayurveda that we have to categorically mention. Then the costing. As far as the costing is also concerned, a lot of efforts has been done, and large number of consultations have been done by the Ministry of Ayush, and amicably even the solutions to the costing also has been taken care by the Ministry of Ayush. So as far as the scope of the Ayurveda packages are concerned, this is not limited to only these disease conditions, but somehow we can enumerate that whether it is a respiratory system, GI system, and genitourinary, metabolic, and dermatological, neurological, even some communicable diseases conditions also, neurodegenerative, ophthalmologic. So that means the scope is, you cannot limit only to one or two disease condition. That is what the intent says actually. Even because if the volume of cases that is reported to the traditional medical systems, and the management at some stage of that disease condition is concerned, we have to take all these disease condition. That is what we thought. Then as far as the definition of the hospital is concerned, as far as whether it is IRDA regulation, whether it is a national health authority, because they are also we are in constant consultation with the national health authority also to include the Ayush systems into the Ayushman Arogya PMJY package actually, and we hope that it will also be culminated shortly into these inclusion of the Ayush into the PMJY packages. There also we have drafted certain guidelines, and similarly the pre-authorization, what are the essential pre-authorization required for these kinds of cases, flat rate or package rate. Then how the length of stay. So during the consultation with many of the insurance providers, this issue, again, I would like to specify that what is the optimum number of days of hospital admission required in the Ayurveda treatment. So if you compare with the modern system of medicine, for example, if it is a surgical procedure, you say that 2 days, one day the pre-operative day, next day the surgery, then after that 3 to 4 days, maximum 5-6 days the patient is discharged. This is not the case with the Ayurveda system of medicine. Everybody, those who are practicing in Ayurveda, they very clearly know how the treatment regime which proceeds from the early stages of interventions to the actual Panchakarma or other kind of whatever the interventions, and which is actually concluding with your Pathyapatya and other, which is actually required to be intervened in the hospital setting itself. That has to be very clearly defined. And there should not be a room for doubt that the patient is unnecessarily kept in the hospital without any treatment. Actually, there is an actual requirement of doctors' constant observations on the patients, and accordingly there is a requirement of specific interventions in the following period also. So accordingly we devise generally for the 7 days treatment or 14 days treatment. So until and unless that kind of treatments are not done in a hospital setting, our treatment will not be completed. So that kind of message has to be clearly provided in each case of standard treatment guidelines. So we try to define that also on that basis. Similarly, it may vary to up to 5 to 30 days, but it is a larger actually. But even though we converge into that, at least 14 days is a general average that we have to say. Then it depends on the Rogabala and the Rogi Bala that we clearly know. Pre-authorization to be renewed for extension beyond initial approval period. Rate should be reasonably considering, because there may be lot variabilities may be there, whether it is the rural area, those hospitals which are functioning in isolated setting in the metro cities where the resources are more, there also different type of considerations may be there. So according to different tiers of cities also the rates may vary actually. So this is what major way which is required to be considered. Similarly, the conditions required in IP management is generally seen. There is a demand for even for the OP basis daycare center also has to be taken care for that purpose actually. So it is true that in many of the conditions, even that as a daycare also the Ayurveda treatment can be is a good viable option, so that also can be considered. But specifically in the context of the IP case treatment regimes, wherever we are adopting these appropriate levels of standard treatment guidelines should be adopted. And many of the, if you follow all these STGs in a systematic manner, including the diagnostic criteria, lab test, the basic treatment principles and the protocol, and the clinical outcomes and the duration, then definitely I think there is no chance for rejection of the claim. Ultimately, the main concern of existing insurance providers and the hospitals per se is how the cases are easily rejected in many flimsy basis actually. So for that purpose, what we advise is that to strictly follow both. That means whether the insurance sector provider as well as the hospital, both strictly follow the standard treatment guidelines, so that there will not be very much deviation from that STG, so that no claim, minimum claim will be rejected on that basis actually. So we have even categorized into mild, moderate and severe as per the severity scale, because the clinical presentation may be like that. Some of the cases may have the severe phases which is reported to the physician. So at that time the treatment choices and the number of duration of the hospital stay may have the lengthier. So that you have to clearly justify in terms of the principles of Ayurveda, principles and practice of Ayurveda. Similarly, package value, how the duration and per day rate, on that way we have tried to amalgamate. And accordingly, we have actually now furnish these documents to the comments, wider consultation and comments, and hopefully, I think, suppose this is agreed upon, actually, throughout the country, uniformly, all the insurance providers can have that standard treatment guidelines as available to them. So even for the assessors, it would be very easy to understand it, actually. Then fraud already I mentioned, privileging mentioned. Then okay, this is what I want to very generally speak about as far as the importance of the STG is concerned. So while we stick on to the standard treatment guidelines, we should have a clear awareness about the implications of the STG. That means the various kinds of patient admission criteria, that should be very clear in our mind. Whether this case is amenable to the inpatient treatment, if it is amenable, at what level, at what stage, and what is the desired outcome, whether the desired outcome can be brought into within that time frame, that is also very important. Accordingly, whether it can be documented. So if we have very documented what I say, history of Ayurveda hospitals in the state of Kerala, for say, example I can say, for in the case of osteoarthritis, for the last 10 years, that itself is sufficient to devise such a STG. However, the government of India has done now the STGs for various hospitals. A minimum, at least 150 conditions are now, it is easily available to the insurance sector. So I hope that by adopting these STGs, you can very well strengthen our insurance sector. Thank you all.
Thank you, sir. Thank you, sir. We will have a round of question and answers at the end of the session.